Are you awake? I don't feel a pulse. Looks like we're in VTAC. Code blue, activate ECMO. Patient is 20 kilos.
Code blue, activate ECMO.
Thank you.
20 kilos, room 6127. Code blue, activate
Initiating
ECMO.
CPR.
20 kilos, room 6127.
Kaylee, what's happening?
The patient doesn't have a pulse, and it appears that he's in VTAC.
Okay, continue compressions. Have we called a code and an ECMO response?
Yes, code and ECMO response has been
Shirley,
called.
can you get the code card and the defib?
Getting code card and defibrillator.
Sally, can you take airway? I want you to continue compressions. You're doing a good job. A little deeper.
I'll go a little deeper.
We'll put the backboard on whenever Shirley gets here, and then we'll get the defib out. This looks like pulseless VT. Angela, can you record? Okay.
Have we already called the national code?
We have.
Ready to place backboard? 15.
Yep.
Okay, go ahead and put the pads on.
Okay, placing the pads.
Shirley, charge to 40 joules and let me know when it's ready. Continue compressions until I tell you to stop, Kaylee.
Charging to 40 joules.
Continue compressions.
Continuing compressions.
Stop compressions. Everyone step away. Everyone clear. Deliver charge.
Charge. Shock delivered.
Resume compressions. Resume bagging at 15 and 2. Hey.
Dr. Smith, I'm the code team attending. How can I help?
Thanks for coming. I'm the team lead. We have a 20-kilo, 5-year-old patient with pulseless VT. We've defibrillated once. We're going to need an airway. Do you mind taking the airway and helping Sally with intubation?
Yep, I can take over the airway and get ready
Continue
for
compressions.
I'm Jake. Sally, I can take over the
Jake, can you draw up a code of epi?
Yes, I'll go.
Thank you.
For 28 kilos.
Bobby's on the airway. Do you mind getting the equipment and everything he needs to help him intubate? It's a pulseless VT arrest.
Dr. Smith? Got your airway spot?
All right, thank you.
Hi, it's a pulseless VT arrest. Are you able to draw an ABG for us and check a glucose from the art
Can
line?
you speak up? I didn't hear.
Sorry, I'll be the team lead. I'm Dr. Lowry. Can you draw an ABG and a glucose from the art line? So just to recap, Dr. Smith is working on airway and we're continuing compressions. It's been less than 2 minutes since our defib and we've continued compressions. We're getting labs and trying to place an OG or NG tube. Let me know when those are complete. Continue compressions.
The OJ's in.
Great. Kaylee, can you switch with Joseph? I'd like for you two to alternate every 2 minutes.
Thank you. I'll do a pulse check. No pulse. Looks like the patient's
Continue
still in
compressions.
VTAC.
CPR.
It's been 2 minutes since last compression check.
Okay, can you pause and do a pulse check? Kaylee, I'd like for you to take over if there's no pulse.
No pulse.
Can I see VTAC on the monitor still?
Okay,
I'll
go ahead and take over compressions. How's our airway?
Continuing compressions.
Airway is paid and I'm ready to intubate.
Since we still have no pulse, we're going to need to deliver a second shock, which will be 80 joules.
Okay, charging to 80 joules. I'll let you know when ready.
Continue compressions and airway preparation.
Ready to shock.
Pause compressions. Everyone step away from the patient. Deliver the shock.
Shock delivered.
Resume compressions. Tom, this is a 20-kilo, 5-year-old patient with pulseless VT, so this will be a candidate for cannulation, so let's get everything set up. Let's give the code dose of epinephrine.
Standard is 0.2 milligrams of epinephrine and a 10 ml saline flush.
0.2 milligrams of epinephrine, correct?
Correct.
Administered in 0.2 milligrams of epi now.
Okay, epinephrine was given at 12:55.
Now that the dose is in, we'll continue compressions to the 2-minute mark and check for a pulse at that time.
It's been 2 minutes since the last pulse check.
Can you stop compressions and do another pulse check, Kaylee?
I feel a central pulse.
It looks like normal sinus on the monitor. Okay, we have return of spontaneous circulation, so I need you to continue managing the airway. If you want to move forward with intubation as we wait for the ECMO team to get set up.
Okay. All right. I'll move forward with intubation.
Got your tube?
Can you keep a hand on the pulse and make sure we still have a perfusing rhythm?
Have a pulse.
Hey. Tube is in place. Color change on our entitled.
If you can continue managing the airway until we get the vent set up. Nice job. It looks like we have a perfusing rhythm and we're relatively stable. So let's work on starting some epinephrine infusion. And I'll discuss with the ECMO team how long they need to stay around.